Kaytelynne. How are you?
I'm good. How are you?
I'm doing well, thank you. So today, what are we going to talk about?
So I am a certified stroke rehabilitation specialist, which means I'm very passionate about stroke recovery and the rehab process. So in lieu of that, me and my partners at Unified, including you, decided to develop a stroke program to help stroke survivors. So I wanted to just touch on that a little bit and let you know kind of what strokes are, how that rehab process looks, and why Unified might be a good fit for stroke survivors.
Absolutely. Well, that sounds wonderful. Let's dive right into that. So kind of tell me a little bit, what is the stroke program about?
So the stroke program is about that outpatient rehab process. So when you have a stroke, you're going to go through different stages of rehabilitation. That could include the hospital when you first have the stroke. That could include an inpatient rehab program, which is a more intense type of program. They also have home health programs where therapists will come to your house. And then at the end of all that, that's kind of where we come in, the outpatient program. And it's never too late, to regain function after a stroke, to continue to work on your skills, to increase functionality. So we wanted to develop something for our community where people at that stage of the process could come and continue their rehab.
That's excellent. So are most people going to be kind of looking to enter this program at about 6 months?
Yes, generally I would say outpatient is going to occur about the 6-month mark. It's dependent, each stroke is different. It could depend on the severity of the stroke, the location that the stroke occurred, the time that, the blockage may have been in the brain, as well as what type of rehab you did after. But generally about the 6-month mark, you're probably finishing up that home health, getting to that point where you're ready for an outpatient program like ours.
Okay. Now you mentioned there's several different types of strokes. What are some of the most common that we'll be seeing in the clinic and that we do see in all those different stages that you just previously mentioned?
Okay, so I think of strokes as dividing them into two main categories. There's an ischemic stroke, which is where the blood flow to the brain is interrupted, and then there's a hemorrhagic stroke, which is where like a blood vessel may burst or tear in the brain. So we're shooting more for ischemic strokes. Those are going to be our most common strokes. The location will depend on the stroke. There's a right lobe and a left lobe, and there's also different sections of the brain. So depending on where that stroke occurs will depend on your deficits. But we're open to either side of the brain, the right or the left, and the majority will be the ischemic strokes.
Okay. So if someone comes in for the stroke program, it's been 6 months, they've been to the hospital, they've been through inpatient rehab, they might have even had some outpatient previously, but they're finding out about our program here. What does it look like? So what does day one look like? And obviously everything's going to be tailored to that person because each person's going to have their individual needs and deficits and severities. But kind of give me a general overview of what that looks like when they first come in and then the days preceding or treatment sessions preceding.
Okay, yeah. So we're going to start with an initial evaluation. That evaluation is really just getting a picture of you as a person. So occupational therapy specifically focuses on what's important to the person and the person as a whole. So that could include your physical functionality, your walking, your standing, your strength. That could encompass your cognition, the way that the brain's functioning, the way you're speaking, things of that manner. Fine motor coordination, your hands. We'll kind of just take a look at everything and see, okay, maybe we're lacking a little here and this has got some room for improvement. So after that, we'll develop an individualized plan for you as a person and address those deficits. If you have, for say, a specific issue with your speech, we could then include our speech therapist on site or our physical therapist. If it's more of a balance or a gross motor problem, that's when we would bring in the physical therapist. The program starts at about a 12-week interval, and then after that, we kind of reassess and take a look, okay, what kind of progress have we made? Do we still need to make some more progress? Are there areas that we're limited in? And then we go from there and maybe extend the program based off of your needs.
Okay. And like throughout that 12 weeks, you're monitoring and checking progress and everything along each of those milestones with a person that's entered the program, I would imagine, correct?
Oh yes, every 10 visits we do what's called a progress note. So we'll set certain goals at the beginning, and then every 10 sessions we'll take a look. Okay, how close are you to meeting that goal? What's your progress been? What do we still need to do? And then at the 12-week mark, we kind of make a decision based off of those multiple progress notes.
That's fantastic. Now, I've heard some people, and this is not everybody, but who have had a stroke, whether it's ischemic or hemorrhagic or other, and they maybe feel at that time that they can't make any more progress, or maybe they've unfortunately been told, like, this is it, this is all you get. So for those people who might be watching this, what advice do you have for them? Why should they continue at that 6-month mark to work towards their goals? Why should they not give up?
So it is true. I mean, you're going to get the most amount of improvement shortly after the stroke, during that acute stage that we would call it. But the brain has this unique ability, we refer to it as neuroplasticity, and it's the brain's ability to kind of adapt and reorganize itself and make new neural connections. And that process is not limited to a time frame. So it's possible, even 6 months out, to have sporadic recovery, to make new neural connections, and really implementing that neuroplasticity and those principles, even 6 months out, can still allow you to gain some function. There's also a plethora of other benefits to continuing therapy. I mean, as you're getting home, you're finishing your therapy, we might need to modify your task or modify your environment. That's something that you might not know until you're 6 months out.
Right.
Things.
Exactly. Yeah, absolutely.
Other things, we're keeping an eye on your recovery, making sure we're doing things to prevent a reoccurrence of a stroke, because you're much more likely to have a second stroke after you have one. And even just for your psyche, your psychological well-being, having that camaraderie of people around you that are also doing rehabilitation, and just continuing to make your life as functional and as filling as possible.
Yeah, it's a big life-changing event. So there's not just the physical, what you see deficits. There's also, like you mentioned, that cognitive, that psychological focus of it.
Yeah.
And changes, and then your friendships change, and you make new friends, and just seeing other people in that same process can be very motivating and helpful, because you might see someone who's where you want to be and you can get there, but you're still 8 weeks out from that. So to see that can be very encouraging. Now, one thing that the stroke program here at Unified Rehabilitation is we offer a couple special things. One thing you mentioned actually right in the beginning, you are a certified stroke rehab specialist. So after your name, you get the alphabet of CSRS. Tell me a little bit about that. What does that mean? Why does that make you unique? And why does that put you a little bit above, just a practicing therapist, OT, PT designation?
Okay, so all of our fields, physical therapy, occupational therapy, and speech therapy, it's a very broad degree, right? So we're seeing tons of populations, tons of different diagnoses, and the CSRS course allowed me to kind of narrow in on the stroke population. So it was a pretty intense program. We did a lot of education starting from the beginning, what is a stroke, as well as really narrowing in on specific treatments that are beneficial for stroke survivors, different ways of addressing those deficits, left-sided weakness, right-sided weakness, the cognition. So it really narrowed in on strokes as, the big diagnosis, and allowing me more education and more skills to really help that population.
That's fantastic. Now, on top of the increased knowledge and applicable skills that you gained with that, I know that here at Unified, we actually have a couple of very unique pieces of equipment that can be used in stroke rehab. Do you want to talk about one of those? One of those, I believe, is the hydro tank.
Yes, Jeremiah is the only aquatic tank in the entire area, I believe, or city. I'm not sure how far out, but the aquatic tank is a great tool to use during your stroke recovery, especially with that weakness. You might have balance deficits after a stroke, and really getting in water, removing that gravity in a sense, will allow your body to move through a full range of motion, and that will help with your stroke recovery.
Yeah, and something that's also very unique about Kaytelynne, and because of her advanced training in stroke rehabilitation, is she's actually very familiar with the gait cycle. A lot of occupational therapists are not as familiar with the gait cycle, so that's actually a very big benefit, that you're able to go through each of those different things, and you don't have to keep switching off disciplines. You get the same person who's kind of evaluating you as a whole person, which is fantastic, and it means, more therapy with one person and more whole body care as opposed to, well, I'm just going to treat your arm and then you're going to go over here and I'm going to treat your leg type thing.
By gait cycle, he means walking cycle.
Yes, walking. How you walk. As crazy it is, there's a lot of stuff that goes into how we walk, and if you've had a stroke, you realize that afterwards how much detail and how much motor control and how much your brain has to tell your feet what to do, type thing. Well, that's wonderful, Kaytelynne. Is there anything else that you'd like anyone to know about the stroke program here at Unified that we're doing?
I just want everyone to really know that it's so important to continue your rehabilitation process, no matter where you're at in that cycle. You know, if you felt like you did all the rehab and you don't think that there's anything else to do, we'll find something. You know, I really am passionate about this. I think everybody should live their life to the fullest, and it's always possible 6 months out even. So don't give up, continue your rehabilitation. And I did briefly want to mention, just for anybody that's had a stroke or just to be aware of the signs of a stroke, because it's really important that you get early intervention if you're ever experiencing signs of a stroke. And an easy way to remember that would be the word FAST, F-A-S-T. So if you ever notice signs of facial drooping, one side or the other, if you ever notice arm weakness, one side or the other, if you have any speech difficulties, then the T is it's time to call.
That's awesome. Very good. That's very helpful to remember. So remember that acronym, FAST, and it could be life-saving and life-changing as well. So one last question I do have is, what about people who may see this and it's been 3 years since they've had a stroke? Could they benefit from this program?
I believe they could. I mean, there's also another thing to mention is secondary effects of a stroke. So over time, if you're not utilizing an arm or a joint, then you could develop contractures or kind of secondary effects from the stroke. So that's something that we could address here as well, more in that chronic stage. So it's always worth coming in, getting an evaluation. We can take a look, let you know what we think. We offer customized bracing and really preventative management as well. So it's never too late. Always come in. Just having somebody that's familiar with strokes take a look, I think just in itself will ease your mind and let you know what your options are.
That's fantastic. Well, thank you, Kaytelynne, for giving us a synopsis of your advanced training and then the stroke program here at Unified, some of the unique features of it, and kind of detailing out, you know, it's kind of something for everybody. If you fit this criteria of I've had a stroke and I don't know what to do next, give us a call. So our phone number is 407-614-8002. We're located here at 14215 West Colonial Drive in Winter Garden, Florida. If you have questions, feel free to give us a call. If you're local to the area or close enough and you want to stop in and tour the clinic, you know, meet the therapist here, just come on by. And if we're available, we will take some time out and talk with you. And if you have any questions, please reach out to us. Thank you, Kaytelynne.
Thank you.